1975 is when I started working full-time. From that time until up about 5 years ago, I had full health insurance coverage. That job ended when the person I was working for retired, went out of business, and then my health started getting worse. I decided to work at home. Well, working at home was a good thing because I was at home with the wife and kids, but I didn't have health insurance. I couldn't afford it.
There are more than 1 million uninsured low-income people in North Carolina. They're not always who we consider the poor or homeless. They're your next-door neighbor, your friend, or the local retail shop owner. They find themselves in desperate need of help because of the high cost of their medication. That's why the mission of NC MedAssist is to provide free prescription medicine to anyone of any age, anywhere in the state with low income. MedAssist expanded its Mecklenburg County services in 2009 to cover the entire state of North Carolina, which has dramatically increased the demand for its services. Since the statewide program began, it has grown from 2,000 clients with 4,000 prescriptions dispensed in 2009 to more than 10,000 clients with over 32,000 prescriptions dispensed in just the first 18 months of operation. During that time, MedAssist has helped North Carolinians in 79 counties. With your help, MedAssist can reach an additional 12,000 new clients and dispense 140,000 prescriptions.
Because of the community's financial support, MedAssist has saved thousands of lives. And in doing so, we prevent unreimbursed hospital costs that occur when our friend with diabetes goes without medication, or our neighbor with asthma has no inhaler. This is why our program is so important. Preventing a diabetic amputation or stroke lowers healthcare costs and lowers it for all of us.
The need is great. Without health insurance, the uninsured find themselves choosing between buying their much-needed medication and putting food on the table. MedAssist eliminates this choice by providing free prescription medicines.
I was at my doctor's office getting some updates on my medication, and he needed to give me some new prescriptions. And I explained to him that we didn't have any health insurance. And so he told me about MedAssist and how they could help out uninsured individuals. So we came down and filled out an application and were able to be approved, and have been able to get our medications through them for about the last 3.5 years.
90 cents of every dollar goes to direct client services. And for every $1 donated, clients receive $8 worth of medication. The statewide expansion was made possible by startup funds received from the North Carolina Association of Free Clinics and the North Carolina Attorney General's Office. These funds will cease in December 2011, leaving MedAssist to operate on support from the community. Therefore, MedAssist needs to raise $1.5 million annually to continue operations across the state. Help sustain MedAssist's prescription lifeline for your neighbors in need.
I don't know where we would be, how we would be paying for our medicines if we did not have MedAssist.
Without MedAssist, it might be a matter of life and death, because if we couldn't afford to get our medicines, we wouldn't have them.